Imagine this: a tiny pill you casually pop for heartburn or gastric problems. But what if that very pill was silently putting you at risk of kidney damage, vitamin deficiencies, and even cancer? Sounds shocking, right? I'm talking about Omeprazole, one of the most prescribed drugs in the world for acidity and gastric issues. What you'll learn today may completely change how you look at this medicine. In the short term, Omeprazole feels like a magic pill. The burning stomach calms, digestion relaxes, and you think the problem is solved. But here's the twist. The real story begins now. This pill, when used repeatedly, shuts down your stomach's natural acid system. And when that defense collapses, a chain of hidden side effects begins. If you want to keep uncovering hidden medical truths like this, make sure you hit subscribe to Clinical Discovery right now, because this next part could save a life. Omeprazole belongs to a class called proton pump inhibitors, or PPIs. These drugs block stomach acid. While acid may seem like the villain, in reality, it's essential for digestion, nutrient absorption, and protecting against harmful bacteria. When you repeatedly suppress this acid, your body loses its balance and hidden complications follow. Research backs this up. A Libyan study of over 300 patients found that 66% developed vitamin D deficiency. Infections became common, and digestion issues like gastritis and confusion appeared. In another shocking case, a woman who took omeprazole for just 7 days developed severe rashes, non-stop diarrhea, vomiting, and even went into shock. Doctors had to stop the drug immediately to save her life. Multiple studies now reveal that long-term omeprazole use can cause chronic kidney disease and even gastric cancer. That so-called magic pill for instant relief. It might be a ticking time bomb inside your body. So what's the safer path? Natural remedies and lifestyle changes. Ginger and chamomile soothe the stomach naturally. Peppermint and fennel reduce gas and ease spasms. Green tea with honey offers anti-inflammatory benefits. And the most powerful solution? Lifestyle adjustments. Smaller meals, avoiding oily and spicy foods, not lying down right after eating, and managing stress effectively. So think about it. On one side, a synthetic pill that gives short-term relief but silently destroys your health. On the other, safe natural remedies that heal your system from within. Which path will you take? Drop your answer in the comments. And if you believe this truth deserves to reach more people, share this video and subscribe to Clinical Discovery. Because here, we don't just talk about medicine, we deliver real knowledge and awareness that can change lives.